I can't tell you how many times in a given week a guy comes to me, he's trying to have a kid. And the first question I ask is, "Are you on testosterone?" They're like, "Yeah, I've been on it for 5 years." They never told me my sperm counts go to zero.
Welcome to the Dutch podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Hi there. Welcome to this week's episode of the Dutch podcast. This week, I got to interview a guest and really talk about things that we've never talked about before on the podcast. Our guest today is a board-certified urologist, predominantly who specializes in men's health. And so we talked a lot about the issues that affect men that are hormone related, but not always hormone related. Things like erectile dysfunction, sexual health, fertility, and then later on in life, of course, men have a lot of other urological issues around different kinds of cancers and prostate function. So today was really eye-opening. We talked about things like the options for male birth control that are out there and how men can take control of their own fertility. We also talked about the workup for infertility for men and what it means for their long-term health when men that are younger have reduced fertility levels. And then we spent a lot of time talking about testosterone levels in men and androgen levels in men and how things like low testosterone symptoms should be worked up in men and managed over time. I think you're going to find it to be a really eye-opening episode. I surely did. And our guest was really charismatic in covering a lot of the issues and topics that men can be sensitive to. This might be a great episode to share with your partner if you're a female listener and you have a male partner who might be considering seeing care, because what was really reassuring to me was that our guest highlighted that urology used to be thought of as a specialty for men over 50. But now his practice, he's in LA, he's seeing younger and younger men who are coming into his practice to take care of their health much earlier in life, which is such a really wonderful trend that we're seeing. So my guest today is Dr. Justin Houman. He's a board-certified, fellowship-trained urologist in Los Angeles. And like I said, he specializes in men's sexual, hormonal, and reproductive health. He really focuses on helping men with conditions like erectile dysfunction, low testosterone, male infertility, and urinary incontinence, Peyronie's disease, etc., offering a really compassionate and personalized approach. He also is a microsurgeon, performs procedures including reduction of varicoceles, vasectomy reversals, etc., always emphasizing minimally invasive techniques. He's in greater Los Angeles, and Dr. Houman is really unique because he's great at explaining, getting what we call the right message at the right time from the right person. You'll see him on social media a lot. And he really helps to blend medical expertise with empathy to help men really reclaim their confidence and their quality of life. It was a wonderful guest. I think you're going to enjoy this interview. Let's get started. So, Dr. Houman, welcome. I'm so glad to have you here.
Thank you. Thank you so much.
So before we dive into the meat of the podcast, I always like to start by just kind of helping listeners get a better idea of your point of view. Because you can share a little bit about your backstory, because you're a board certified urologist, but you treat a wide range of conditions in your practice. But you really have kind of a more specialized perspective in how you look and how you treat men. So can you share a bit about your backstory and kind of how you got to where you are now?
Yeah. So as you mentioned, I am a urologist. So I did a urology residency where we look at primarily the male urinary system. But with that, we do a lot of cancer, with kidney cancer, prostate cancer, bladder cancer, testicular cancer, men, women, children. At some point, everyone needs a urologist in life. And that's initially what drew me to urology. I still do a good amount of general urology, but within that field, within the field of urology, now I specialize in men's health, which is there's a couple buckets within it. So when I was in residency, at the time, I noticed that there was, first of all, there was very few people who do who are urologists who specialize in men's health. And the
Mm-hmm.
buckets within men's health, there's men's sexual health, fertility health, hormonal health, those three things. And you really see it. I mean, and we're seeing it more and more every day. These things are very, very important for men because it's really the first touch point for men to get involved in the healthcare system. So once they get involved, once these are the things that bring men to the doctor for the first time, and with that, We provide them with the obviously necessary information to address their needs now and then going forward into the future.
It's so interesting that you bring that up, and I guess I'd never really thought about it being such a one of the top reasons why men seek healthcare, because they do traditionally, women pursue healthcare even for their partners. A lot of times it's women who drive like primary care medicine, for example, and checkups. Like women tend to do more preventive care and engagement with the healthcare system than men do. So what I'm hearing you say is that oftentimes men are first coming in because they think they have low testosterone or they have some kind of sexual
Exactly.
arousal disorder or something going on. Is that kind of what you're talking about?
Yeah, exactly. I mean, men won't be able to tell you when they have high blood pressure,
They
diabetes,
don't
high
really care because
cholesterol.
it's not impacting them as much.
Exactly, but they'll tell you when they can't get an erection, and they'll tell you when they're urinating at night, when it bothers them, and that's again, as you that's why we're really the first touch point for men.
Now, I know that people traditionally think these are problems with older men, but from what I've read, we're seeing younger and younger men affected. Have you seen that in your practice too?
Oh, without question. Yeah, yeah. Well, I mean, younger men with erectile dysfunction, younger men with low testosterone. Obviously, infertility is a whole different. Infertility is
Mm.
becoming more and more common. Um, Even young men are experiencing infertility issues, and we could talk more about that. But it's really a lifestyle thing primarily.
Well, let's start by diving in because I think this is such an important piece of like groundwork for people to really understand because when we think about some of these impacts with sexual arousal, with fertility, I mean, the data is really interesting, particularly fertility is the field that I was predominantly in practice. And there's some really interesting research on mostly men with infertility having different outcomes with their health span later on in life. Higher incidence of certain cancers, even all cause mortality is higher in men who experience infertility in their 30s. And it really points to, like you said, this lifestyle connection where it's not that infertility causes death, but it is a marker of the terrain of like what's happening with lifestyle, with terrain. And so it's an interesting thing. Same thing with, with sexual arousal disorders that you end up seeing that there's cardiovascular reasons for that and these underlying reasons. Can you kind of paint the picture for listeners about, this urology is kind of that first point of entry, but it's like opening a door to Pandora's box. And there's a lot more behind that symptom that crops up across
Yeah.
those different areas.
Yeah, exactly. Very well said. So the way I like the analogy I use is these are sexual health issues, fertility issues, hormonal issues. They all, they do within the Venn diagrams. They share they all share a little portion of it. But these are like canaries in the coal mine, if you will.
Yes, I use that term exactly. Yeah.
Yeah, if you're experiencing any of these issues, it could mean like if you're a 30-year-old with erectile dysfunction, a lot of times that's psychogenic or it's performance anxiety related. But there's plenty of times where it's actually an early sign of you have high cholesterol where those arteries that are carrying blood flow to the penis, they're clogged up, or it's a sign of cardiovascular issues, not just some arterial issue, but maybe there's something going on with your heart. Even it may be a sign of hormonal issues, right? Hormonal issues where you're having low T because you're not exercising, you're not eating right, you're stressed out, you're not sleeping right. All of these things can be. It's usually the first sign because as young men, our bodies are very very resilient, but it can only carry you so far. And sexual health is usually one of the first things that we realize, primarily because it's so important to us. And that's the thing that we notice it. We're much more sensitive to
Mm.
noticing the impact from a sexual health standpoint. And that's why if you're experiencing any of these issues, fertility health issues, sexual health issues, hormonal issues, to your point, um, the longer you wait to address it, this is when it becomes something that causes significant morbidity. Your quality of life gets um, negatively impacted. And even more, longer term, the more you delay with it, even your overall lifespan could be negatively impacted.
How well do men receive that message when they come in? And I think my other question is like, do most urologists think that way? Or is that something that really you're thinking about as someone who's more lifestyle oriented?
Well, I would say most urologists, we see patients. The first time most guys come to a urologist are usually when they're having urinary issues. So, in their 50s, 60s,
Mm.
Medicare age later on. My practice is quite unique. I deal with a much younger patient population, 20s, 30s, 40s. Um, so, I mean, for me, it's a big thing. So in that sense, yeah, it is. It's something that I preach more. At least I
Mm.
could say I think I preach more than others.
Yeah, that's great. Now, I want to talk a little bit more about like the hormonal imbalance. 'Cause I think this is really piece that most men are coming in, and there's a lot of signs and symptoms of low testosterone or low androgens. Can you share a little bit about what you're seeing mostly in your practice in these younger men who are coming in to see you?
Yeah, we are seeing more and more low testosterone. I could tell you, in every year, and it really started during COVID. That's when we really saw
Oh, interesting.
and I will say this: I don't think it had so much to do with. I do think some of it had to do with just COVID, and we were very sedentary during that time. But, and this is like something I do want to highlight is younger men are more proactive about their health, which is very important.
Mhm.
They are addressing when they are having issues. They're way more likely than previous generations of men to see a doctor, whether it's online or in person. Right? There's tons of healthcare resources out there now from at-home testing, so it makes it quite easy for guys to engage in these conversations. But low testosterone is becoming more and more common. I'd say it's a number of things that are causing it. Again, I mean, lifestyle, but within that bucket, what I tell you is obesity is a big one. Men are way more overweight. Our sedentary lifestyles, we're going from, uh, basically waking up, driving, getting to a bus, a car, whatever it is, going to an office, sitting for 8 hours, coming back home, sitting in front of a screen, watching Netflix, rinse and repeat, right? That idea where we're not staying active, we're not getting sunlight, we're not doing the things that are important for a healthy lifestyle. We're getting a lot of blue light, and negatively impacting our sleep. Sleep's quite important for testosterone production. So all of these things are really negatively impacting our health. And then the third thing, our hormonal health. But the third thing is
Mm.
processed foods. Processed foods are a big one. And we're eating a lot of processed foods, and nutrition is very important for healthy hormonal levels.
Yeah, I mean, you touch upon a lot of the kind of those core foundational pieces that we sing about all the time for, women as well. But and it's similar, like endocrine disrupting compounds, light disruption, lack of movement. I mean, these are the things that foundationally end up contributing to chronic disease that lead us into all different specialties of
Yeah,
medicine.
exactly.
Can you talk a little bit about your testing approach when men are coming in with these kind of complaints of low hormones? And is this a problem? See, the other thing I'm thinking about is like now that I think one of the benefits of social media is that men are increasing their awareness and they're coming in to see doctors sooner. I mean, there's a lot of bad things about social media, but I think the democratization of health information is a good thing that's happening. There's a lot of junk out there too that you probably have to sort through with patients sitting in front of you in your office all the time. But I generally think there's just a lot of information. Like you said, this younger generation is more aware or more health conscious. They're taking more preventive action. And I think that's probably a result of what they're exposed to. Um, but tell me a little bit about when men are coming in to see you, like what's the evaluation process? Let's talk specifically about men's hormonal health first.
Yeah, but to your point about social media, I do agree with you. It's great. I do wish that there were more doctors who are preaching a lot of these messages. A lot of times it's sometimes it's the wrong message from the wrong messenger, but people who know what they're talking about. Unfortunately, medical doctors aren't as prevalent on social media as they can. They hopefully they can
Did
be
you
or
get
should be.
Yeah, did you get pushback about being online so much from colleagues? This is like an
No,
aside question, but I wonder about that. I've heard that from a couple of physicians where people thought it was a waste of time or whatever, but it seems like I think it's wonderful. I would agree. I think better information would be
yeah,
fabulous.
yeah. Right message from the right messengers
Right.
is probably the best view of the best way medical information can be put on social media. But to answer your question about how hormonal health is assessed, most guys when they come to me, I don't want to say they've either already gotten tested for low testosterone, they're coming to me for treatment options, or they're having significant symptoms where they want to get diagnosed. And really, the key here is the way I do it is. Um, I always want to make sure that we're providing the right testosterone optimization program for each guy. We custom tailor everything. It's not every guy, whether they're 20, 30, or 80, they get the same treatment plan. That's not what we do. And we don't do, not everyone gets testosterone replacement therapy. There's ways in which we could preserve their fertility while optimizing their testosterone, which is a huge thing. I'm very, very big on that because I can't tell you how many times in a given week a guy comes to me, he's trying to have a kid. And the first question I ask is, are you on testosterone? They're like, yeah, I've been on it for 5 years. They never told me my
Hmm.
sperm counts go to zero. So it's a big, we want to custom tailor everything towards the patient's goals, their expectations, their current lifestyle. So we do a whole blood panel. We check the pituitary hormones. We check their estrogen levels, we check their testosterone, their free testosterone, which is probably the most important thing. Obviously, we do a physical exam just to make sure everything's looking good. And as long as things look good, we custom tailor everything based on those hormone results.
That's great. Now, when you're talking about men on testosterone when they're trying to conceive. Can you dive a little bit more into that concept for listeners?
Yeah, so the testicles do two things. They produce sperm and they produce testosterone. Anytime you're producing or you're giving the body synthetic testosterone from the outside world, whether it's creams, injections, pellets, the testicles get the signal that there's plenty of testosterone, so they shut down. They stop producing testosterone, but more importantly, they stop producing sperm. It is a temporary shutdown in most cases. When I say temporary, anywhere from 4 to 8 months with some variation there. But that shutdown is quite important because they're expecting they're trying to conceive while they're on testosterone replacement therapy, not knowing that you can't, not knowing that there's no sperm. So the way we do it is we have a number of ways in which to do it, but we try to enhance the testosterone function of the testicle while preserving fertility. So there's different medications we do that signal the testicles to not just continue to function, but function better, boost up the testosterone production, maintain the fertility production, and in doing so, you're preserving that fertility while optimizing their testosterone.
Yeah, this is worth talking about. I saw this all the time in practice as well. And the other piece that I would say, because I was looking at clients who predominantly wanted a functional medicine or integrative medicine approach, that there were a lot of men who came in on um, like testosterone enhancing supplements, which is one of the dirtiest categories of supplements out there. And a lot of them, I could tell, I'm like, you're on some kind of like muscle builder or growth, supplement that has some kind of testosterone analog in it because you'd see the same suppression even when they weren't on testosterone. So I like to point that out because if men are going to be on supplements in this category, it's so important to work with a professional grade brand and not buy like gas station supplements that are enhancing
Yep.
because you do see junk on the market. And whether it's weightlifting, bodybuilding, testosterone boosting, sexual enhancement, that whole category of supplements oftentimes has adulteration, which what that means is that they'd be putting something in the product to get an outcome, but sometimes they're medications. We've seen like Cialis, Viagra type medications laced into dietary supplements and also testosterone analogs. So anyway, I would come in and test men and see their testosterone quite low and sometimes find that they were either on testosterone and they knew they were, or they're on testosterone and they didn't know they were through some kind of supplement protocol. But important to know that there's other methods out there to support testosterone, like Clomid or using HCG with testosterone
Exactly.
that can get around that problem. So there's other solutions out there for men, but it's definitely a big, big problem that a lot of people don't know about.
Agreed. Absolutely.
So I want to shift gears and talk about something that I've seen you talk about on Instagram, which is birth control. Birth control has obviously historically been female focused, and that's really shaped the way we think about birth control in this country and like whose responsibility is it? But you've talked about like male contraceptive options as well. Can you talk a little bit about why this is something that's interesting?
Yeah. I mean, the best version of a male contraceptive is the vasectomy, right? To get a vasectomy procedure done, which, and this is the thing. I think a lot of guys are quite fearful of it, just because it's a vasectomy and they feel like any type of procedure down in that territory can be painful, can cause side effects, can have a bevy of negative outcomes. But in reality, it's a very straightforward procedure. You always want to go to somebody who does it a lot, just because they're experienced with it. But I would tell you, it's something that we do like on a daily basis. It takes about 7 minutes, minimally, very little pain associated with it during the procedure. You have no pain associated with it during the procedure, and afterwards, the recovery is a few days, no more than a week, and you're back on your feet, ready to go. But the reason why I think it's kind of the only fair way of doing things. The female contraceptives, they're either implants that you have to exchange out, whether it's every 5 or 10 years. That process can be painful. Even the process of the implant just being in there can be quite painful. There's the hormones associated with can cause a lot of issues back and forth. So this is a very straightforward. It's a one and done. There's no late side effects. It doesn't cause any hormonal health issues. Doesn't cause any erectile dysfunction. No sexual side effects. No libido issues. Again, very, very well tolerated. Which is the reason why To stand on my soapbox here, I think a vasectomy is what any couple who's done with their fertility, the guy should undergo a vasectomy.
I think the best time for a woman, a female partner, to ask their partner to get a vasectomy is like literally after birth. Then
Yeah,
you've like
yeah,
just gone through the labor and you're like, okay, next it's your turn. It puts the contribution in perspective.
yeah.
You have a 12-hour labor or whatever versus a 7-minute procedure.
Tit for
No, it
tat.
is a tit for tat. That's right. It is a really fabulous, and I think you bring up a lot of really important points, like even a cost perspective, the hormonal implications for female birth control. For the majority, I mean, there are some non-hormonal options like the copper IUD, but
Hmm.
for the most part, they will have cycle disruption. And I think now that we know how much a regular menstrual cycle is a marker for health for women, doing things that disrupt that, like oral contraceptives, there's downsides for a woman even knowing what the status is of her health when that cycle is overridden um, by hormones from a contraceptive point of view. So I love that you talk about this. Are there other male non-hormonal birth control options besides vasectomy?
We're doing a little bit of research on this. There's a few companies out there who are trying to do like a reversible. They're trying to use
Oh,
different
like a gel that dissolves, right?
yeah,
Yeah,
different
I've heard about
polymers
that.
that go in the vase. The jury's still out. I think the technology has to improve a little bit more to get there, but there's a few startups in that space right now trying to address that.
It seems because that would be an injection typically.
Yeah, an injection into the lumen of the vas deferens, right into that hole, and then the idea would be that they could do a reversible agent into that same lumen in order to reverse it, rather than the way we do it now is I'll do a vasectomy on somebody. Let's say they change their mind 5, 10 years later, we'll reverse it, and that's a whole different procedure. But again, it's a surgery where you have to make an incision and bring those two ends back together.
My
But they're
husband had
trying to
that done.
create. Say that again.
My husband had that done. He wouldn't mind me sharing. He's public about it, but he'd had a vasectomy before we met, and then when we got together, we decided to have children, and he was like 7, 8 years out from it. So there was difficult to even find someone who would do the reversal because the rates after 5 years are not typically as successful. But we had 2 children after that, so it worked for us. But that procedure was more painful for him than the vasectomy. He said the vasectomy was nothing.
Exactly, exactly. Vasectomy is straightforward. The reversal requires it's a longer. I mean, it's a bigger surgery from our standpoint,
Yeah, yeah, but it was successful and definitely, allowed us to grow our family. We think about vasectomies as being permanent, and typically you wouldn't want to do it unless someone wanted permanent birth control. But it's definitely a really nice option available for couples from a family planning perspective.
for sure. Yeah,
If
agreed.
male birth control, like other forms, I mean, we haven't really talked. Have they tested oral forms of birth control for men?
They
I don't remember
have
hearing of that in the past. They really weren't very successful.
precisely. Yeah, they're not that successful because I mean the thing is you really want to get to zero. It's not like all right, you're limiting the sperm because anytime a guy ejaculates, a healthy male, he's ejaculating tens, if not hundreds of millions of sperm. And all you need is one of those sperm to get to the egg, and you have an embryo.
Mm,
So you have to have a 100% success rate in terms of stopping sperm. And the best way of doing it, again, in modern medicine today, is just blocking that path.
yeah, great.
We'll be right back. Here at Precision Analytical, we've launched the biggest update to our report since 2013. The new and enhanced Dutch report puts the most actionable hormone insights right on page 1, making it faster and easier to interpret. You'll see a reimagined summary page, upgraded visuals for estrogen and cortisol metabolism, and an all-new About Your Results section, what we call the Dutch Dozen, a 12-point framework that helps you understand your patient's hormone story in minutes. It's a smarter, simpler, and more insightful Dutch experience. From now through December 19, 2025, all registered Dutch providers can order 5 Dutch Complete or Dutch Plus kits for 50% off. Give us a call or visit DutchTest.com/order now. Must be a registered Dutch provider. Promotion not available through distributors. Can mix and match Dutch Complete and Dutch Plus kits. Prepaid only, no drop ships. Cannot be combined with any other offer. Kits must be purchased by December 19, 2025. Welcome back to the Dutch Podcast.
Well, I want to shift and talk a little bit about fertility now, because as you think about men's health, kind of that second category of fertility, obviously there's a hormonal component and there's also some kind of nutritional and lifestyle components. You spoke to these a little bit earlier, but can you talk about when a man is coming to improve his fertility, what are the key areas of health that you think about?
Really, it comes down to I guess like the way to think about it is like you need the mashed potatoes before you get the gravy. But like the mashed potatoes, like the essence of it, you need four things. Obviously, nutrition is a big part of it. Not everyone is perfect with this, and they're you don't have to have a perfect nutritional diet plan in order to conceive well, but really it comes down to a good amount of healthy fats, lean proteins, complex carbohydrates. And the beauty of that is it's not just good for your fertility health, it's good for your overall health, your cardiovascular health, your metabolic health, everything. So in that sense, you're killing a bunch of you're crossing off a lot of boxes in terms of health. Exercise wise, you always want to mix heavy weightlifting with, or weightlifting in general. I don't want to say heavy weightlifting, but weightlifting with cardio. Try to exercise 4 times a week, and generally every other day for 30 minutes is a good place to start. Stay active, move around. Try to at least walk every day, get some sunlight. That brings me to the third point, which is stress reduction. If I had the answer for you, if I knew how to tell you how to reduce your stress, I wouldn't be doing what I do. Um, but find out what reduces your stress levels. Not everyone has the same thing. For some people, it's a morning exercise. For some people, it's a morning meditation. For some people, it's talking to friends and spending time with family. One of the hardest things in life is figuring out what reduces your stress levels. And I could tell you, amongst my older patients, the ones who are the happiest and the healthiest, and who are literally living the longest, they know they figured out how to make them, or what makes them happy, and they've maximized that. They've taken that to the limit. So figure out what's important to you in terms of what makes you happy, because that'll reduce your stress levels. And then finally, um, sleep. Sleep is a big one. Sleep is good for everything, for mental health, for physical health, for even our stress levels. But try to get at least 7 hours of sleep a night. Again, if I had the answer, if I knew how to do that for myself, I would tell you. I'm still working on
I
that.
love that you bring up that like the older men, they've identified that kind of the ones with the most longevity. They've identified what is it that, helps them really reduce stress. Interestingly, just last week I saw this article on, do you remember the Blue Zones book by
Yeah.
Dan Buettner?
Hmm.
Like they were studying, if you guys, it's an older book. It came out, God, probably maybe 10 years ago, maybe more than that, 20 years ago. But he looked at the blue zones, which were these areas on the planet where they had the highest number of centenarians, or people that lived over 100, and evaluated what were the patterns that they saw. Well, they actually put all of his data into an AI model and found they like reanalyzed the data, and
Yeah, I
they
saw that.
actually found that the biggest indicator across all of them was not related to like alcohol intake or even nutrition. We had some, but the largest impact by far was connection and relationships and solid relationships. And I think a lot of that is that stress reduction and pursuing joy. And I mean, I really think you can meditate, you can do yoga, but when it comes to true self-care and stress reduction, I think no is our most powerful, like 2 letters, right? You got to align yourself and your life with the things that bring you joy and move away from the things that don't. And so I love hearing you say in your older populations, they've nailed what reduces their stress. 'Cause I think that's just another way to say the same thing, which is just how remarkably important that is.
Yeah, reducing chronic stress.
Yeah. And I want to talk double click on that a little bit, because I think there's a really deep connection with testosterone levels, which men really care a lot about, between stress and sleep. And then alcohol use is another one that I would throw in there as well. What are your perspectives on those as contributors? Like I know that for some, when men have low testosterone, particularly when they're younger, assessing for sleep apnea can be a really important piece of their workup. Can you talk a little bit about some of those big contributors from that point of view of stress and sleep?
Yeah, for sure. So, well, one thing, when I mean, poor sleep obviously will lead to, it'll give you a little bit less reserve in order to deal with the daily stressors of life. So, may cause a mild impact on you if you have a series of a couple weeks of getting good sleep, that may not negatively impact you throughout the course of the day. But if you're running on fumes, you're getting 5 hours of sleep for a week. That's going to cause it's not going to let you deal with the stressors of the day and the week as much as well as you would have if you got good sleep. How testosterone relates to all this, I've had a lot of patients will say, "Look, I'm just not getting good sleep," and when we improve their testosterone levels, obviously they feel
Mm.
better, they have more energy, but they're getting better sleep. Their sleep, they're tracking their metrics. They're actually getting better sleep, 7 hours of sleep a night, and that's only helping them in terms of dealing with a lot of stressors. So there is a lot of everything is kind of connected in this from a hormonal health to a stress management standpoint.
Mm.
It's all kind of connected.
Yeah, so I'm hearing you say it's like a chicken and an egg exercise. The poor sleep would affect testosterone, but low testosterone can affect sleep as well.
Precisely.
So beyond testosterone, like are there other hormones? You'd mentioned that you test things like estradiol or estrogen, and you talked about stress, like stress hormones like cortisol. Do you look at those as well when it comes to assessing a man's vitality and kind of hormonal balance?
Definitely. Estradiol is a big one. I don't think cortisol gets as much credit as it should. The only thing about cortisol it's a little bit more difficult is like estradiol, we could play around with it, right? We know testosterone gets converted to estrogen. Estrogen is quite important, or it's important for men in general, but estrogen can too much estrogen is not good, right? Cortisol is a little bit more difficult because we can't necessarily act on cortisol levels. We can tell if someone has a elevated cortisol level, that's okay.
Hmm.
Well, it's important, it's diagnostic, but um, hey, try to do whatever you can to reduce your stress levels. How do I do that, doc? Well, I mean, again, it's come back to these things that we just talked about. Figure out what brings you joy, meditate, exercise, sleep, all of those things.
It's interesting that you bring that up because what I'm hearing you say, which is I think really, really rings true, is that we know cortisol is impactful, but because we can't treat it, it doesn't get as much attention in medicine.
Exactly.
And it's so interesting because if there was a drug that could raise or lower cortisol effectively, it would be
Yeah,
a huge market and we
we
would
test it
test
for
for it, we
everybody.
would treat it. And so I've never really thought about that before, about why we don't look at it. And I've seen it myself and talked with practitioners. It's one of the hardest areas of health to improve, like that HPA axis dysfunction. But if you look in conventional medicine, it's like Cushing's and Addison's and nothing in between.
Yeah,
Whereas
yeah.
if we could actually treat it, maybe we'd have a different perspective if there was a pharmaceutical out there to
If there
raise
was a
or lower
magic
it.
pill, yeah.
Gosh, that's like a total insight of this podcast time. But I think you're really right. It's something that it's really hard to wrap your hands around how to help people.
Yeah, other than
Um,
lifestyle interventions.
yeah, like you said, which are so hard to do, and they're so variable from person to person as well. Now, I want to talk a little bit about the Dutch test because this is one example of how clinicians are kind of digging deeper and trying to get more hormone insights on the patterns that they see. How do you see like tests like that helping men connect their symptoms, let's say like low libido, to what's happening hormonally? Like, do you consider things like metabolites, DHT levels, things like that as well?
They're all interconnected. Like any alteration, there could be. Let's say we're testing for 5 metabolites or 5 of these hormones. If I had one for me, maybe just being off on one of those could really negatively impact me. But for somebody else, it may take being low in 4 of those. They're deficient in 4 of those for them to feel it. So biology is different for every individual. So the more data points you have, the more valuable it is. Primarily, number one. Number two. Um, with that point, in terms of more data points, getting like a urine test is much easier than a blood test, right? A blood
Hmm.
test requires a lab, it requires somebody to draw your blood. A urine test anyone can do. So, like anything else, the more data points you have, you're gonna make a you're gonna have more diagnostic data points, and you're gonna make a more sound decision from a clinical standpoint, in order to properly diagnose and treat somebody. So, that's the beauty of the Dutch test in that sense.
Mm. Yeah, and a lot of men don't realize, like, they probably think that when they are having issues with energy or mood or even fertility, they think first about testosterone only. But it's really like a symphony of hormones for men, just like it is for females. How do you explain that to your patients in a way that they get it?
Wait, that testosterone is important to women?
No, no, that it's not just testosterone for men. That they have you've talked about estradiol, you've talked about cortisol, we've just talked about metabolites. Do men understand? I feel like they come in looking with kind of blinders on, focused on testosterone, but sometimes it's like the whole terrain, the whole environment of hormones.
Yeah, I would say most men, when you think of when they think about thyroid, cortisol, that resonates with them. It's not that hard for them to
Mm.
understand that one. But any of them, when we do the blood test, they see estrogen or they see estradiol. They'll look it up these days and be like, "Wait, doc, am I a woman?" No, no. Literally, like someone this weekend texted me or sent me an email like, "Am I a woman?" I'm like, "No, no, you're okay."
We all make
All men.
estrogen.
Yeah,
Yeah.
all men need it. We need it. As men, we need it. It's important for libido. It's important for bone health. It's important for metabolic health. A good amount of it, not too much of it, not too little of it, but there's a nice middle ground there.
But there can be imbalances where men might actually make adequate testosterone, but their detoxification pathway pushes it through estradiol and it gets kind of stuck there. Same thing with estrogen metabolism, where you can see their metabolism isn't great. Could be related to gut health, it could be their genetics, but they end up producing too many estrogens, and you kind of get that imbalance between testosterone and estradiol. And you mentioned to that before that you don't want it to be too high. In my experience, high estradiol in men, even if testosterone is adequate, can feel a lot like low testosterone.
Yeah, absolutely. It compete. Well, look, it competes for one. It competes for the receptors, but more importantly, it's the ratio that's the most important thing to us. You want at least a 10-to-1 ratio between testosterone and estradiol. Anything less than that, you're not really gaining the benefits of those testosterone levels. So that's kind of the place to start for us. But this brings us back to the point of everyone's biology is different. So you really want custom tailored care towards your hormonal picture in order to make sure you're getting something that's tailored towards your needs.
Mm. Now, when men are on testosterone replacement, this kind of gets to, do you do any kind of monitoring ongoing for them? Can you talk
Definitely.
a bit about that? And because I think it goes beyond testosterone levels.
Yeah. So I mean, obviously, look, testosterone is very, very safe. Um, we have tons of data supporting how safe it is. There's a lot of misconceptions about testosterone causing prostate cancer, causing strokes, all of those things. We've disproven all of those. There was a bad study that came out initially that, at this point, I think we've published 27 studies contradicting that initial study. But that being said, you always want to measure blood levels. You want to make sure people aren't doing too much testosterone. You want to make sure the estradiol, as we just mentioned, is staying at a nice ratio. You want to keep an eye on their PSA. PSA is a marker for prostate cancer. So we do want to make sure you're trending their PSA. And then finally, we want to make sure that their red blood cell count is staying stable. In, in rare cases, or in less common cases, I should say, testosterone raises your red blood cell count, if it's unmonitored, your blood can become very, very thick. And in incredibly rare cases, you have heart attacks or strokes. So you do want to make sure you're doing blood work. I generally, at the start of treatments, see patients back every 2 to 3 months just to make sure we're on a good path. And once they found a nice routine, nice stable regimen, we'll do every 6 months, twice a year. We'll check blood work.
Great. Cool. Now, I know another reason why a lot of men come in to see urologists, you mentioned this before, is sexual health, kind of that third category for urology. Can you talk a little bit about some of the main underlying drivers? We started out with this, but I want to spend some more time talking about it because it's such a big concern for men. So what are the areas that you typically would evaluate when a man comes in with complaints about difficulty with an erection?
Hormones are a big one, and blood flow are a big one. Obviously, depending on age, if a 20 or 30-year-old comes in, we're thinking more performance anxiety or porn-induced erectile dysfunction. Majority of guys are in that bucket when they're 20s and 30s. But as men age, 40s, 50s, 60s, hormonal health is a big one. Various issues that cause decreased blood flow to the penis. So high cholesterol, diabetes, high blood pressure. Those are the things we look at.
Is that something that you guys work up as urologists, or would you pull in cardiovascular, like a cardiologist, to start to do that workup?
So cardiologists, primary care doctors, they're the ones who are screening most guys. I mean, luckily where I practice, I'd say most guys are getting their annual physicals. Upwards of 90% of men are.
That's
So I
great.
see that data, right? I see
You're
that
in
data.
LA, right?
Yeah, exactly,
A
exactly. So
little bit
men are
more investment in healthy lifestyle.
precisely.
Yeah.
So in that sense, it's a little. I do see that data. So, but even then, right? Let's say they are having high cholesterol issues. Their primary care is still working on it to lower those cholesterol levels. A lot of times, the damage is irreversible to those arteries that carry blood flow to the penis. So in those situations, I, it's obviously it's good to know that, hey, maybe this is the reason why, but we still work them up from a hormonal health standpoint, and most importantly, we try to treat them to
Mm.
get them back to optimize them sexually.
Well, because a lot of it's due to microvascular damage. Is that right? Where they end up those like capillaries and smaller blood vessels kind of get the damage first.
Precisely. Yep. Well said. Exactly right. Those are the smallest ones. Those are the ones that get calcified first, and those are the ones that get obstructed first.
Now, what about some of the stuff that I've seen on like nitric oxide support nutritionally? Is there any validity to that?
Yeah, I mean, there's supplements. There's some amino acids. L-citrulline, L-arginine are probably the most well studied amino acids in this space. They can help, right? They definitely can help. They can only help. But what I would say is, usually speaking, and I don't want to make this a broad generalization, but those supplements usually are for guys who have mild erectile dysfunction.
Hmm.
Guys who they're still able to have erections, they're still able to penetrate, they're able to still maintain throughout the course of maintain an erection throughout intercourse. Um, but if a guy is really unable to get anything, very little activity, these supplements really aren't going to move the needle a lot for him, or they're not going to move it to the point where they're achieving satisfying erections. So that's when you really want to think about pharmaceuticals.
Yeah, that makes a lot of sense. I think looking at the level of need that people need, when they come in, what level of intervention is required depends upon the severity of disease in any case that you're looking at.
Yeah, exactly.
Now, I want to get to this like canary in the coal mine piece that we talked about before, because I think this is a really interesting element of care when you're looking at men's health. Is that you've talked about how a lot of these are markers of, let's call it like development of chronic disease. Like we can use fertility as an example, where if your fertility is poor when you're in your 30s, it's not supposed to be. It's probably other underlying factors that are affecting your fertility or probably affecting other areas of your health. You're just not seeing it yet. That fertility is the first measurable thing affected. Now, what do you think about having that as being like should semen analysis be a marker for men's health that we look at throughout different stages of life? Like, could there be a value to men knowing what their status is and how it's changing over time?
Yeah, I mean, I don't. So I would say some people have said, and this is, I don't want to take
I've read
credit for it.
No, I've seen that, and I just find it really interesting.
Yeah, I mean, is it worth? So some people say it should be the sixth vital sign, right? A semen analysis should be the sixth vital sign, um, and I don't disagree with that. But I think any guy should get a baseline semen analysis, right? These days, you could do it at home. There's a $200 kit that you could buy online. There's a couple of companies that do it. They mail the test kit to your house. You do it. There's a preservative in there that's almost it's incredibly precise. It's very
Yeah,
accurate.
Give
Um,
Legacy is the one that I've seen,
or
and
Meat
that is
Fellow. Yeah.
Reprosource the other one? What's the other one that you've used or
There's
seen?
Meat Fellow, there's Legacy, there's Sapien, I think is another one. There's a number
Mm.
of these companies. Um, but what they do is, I mean, you do an at-home test, you see where you stand. If there's any abnormalities, you work it up. The earlier you intervene from a fertility health standpoint, I could tell you, the earlier you intervene, the better your outcomes will be. If you have a varicocele, for example, um, treating that in your early 20s versus your mid 30s could play a big role in terms of the type of damage that's caused to your testicles. And the thing is, this is the thing about fertility. There's no symptoms associated with fertility,
Mm.
right? Or infertility. So if let's say you're producing severely low sperm counts, it's not the kind of thing that you're gonna feel throughout the rest of your body. You're not gonna have pain. You're not gonna have a cough associated with it. You may have low testosterone associated with that, because that obviously low testosterone can negatively impact fertility. Um, but the point here is getting that assessed earlier on will help big picture for your reproductive health and your overall health.
Yeah, there's been such interesting data lately on like mitochondria, and mitochondria are such a critical part. They're really involved in most chronic diseases, even metabolic health and things like that. And I think one of the reasons that we look at fertility as such an important marker is the testes are the richest place for mitochondria in the male body, and for women it's the ovaries. We think about mitochondria for cardiovascular health, and that's important as well, skeletal muscle, but actually our organs of fertility, our gonads, are the ones that have the richest mitochondria. So I think that's why we see them affected so early, but can be a sign of that kind of poor nutrition, poor mitochondrial status, which is required for energy production, which affects all of our cells in our body.
All of
So
ourselves. Yeah,
yeah,
exactly.
just such an interesting perspective, because I do think that in the next 10 years, we're going to be seeing shifts in urology similar to other categories of health where we're starting to look at that. We'll see what happens. We'll see what the data shows.
Yeah, it'll be interesting.
Great. Well, we've had the chance to talk about a lot of different things on the podcast today. What are you most excited about as far as what's happening in the field of urology?
Um, I do think that, well, a couple things. I think I'll say within my sphere of primarily with men's health. I do think there's a couple things, but men are engaging in these conversations more and more, which is great because I think there's a taboo associated with some of these discussions that we talk about sexual health, infertility. Younger generation men are way more willing to engage in these conversations and to see physicians, which is wonderful because I think that's just going to help overall health of young men much better. It's gonna help significantly in that space, which I like that idea. And then a lot of this, when it comes to telehealth and some of these new technologies where we're able to do at-home testing, really bring what the physician does to the patient at home, make it as convenient as possible for patients. We're seeing that. I think with every decade that goes by, every 5, 10 years, we're seeing big improvements in that space. And again, really improving access to men really engage in the healthcare system, taking care of themselves, hopefully help with ultimately living longer lives. Because we do see, men live shorter lives than women. Men have more mental health issues than women. Men are more likely to die by suicide. There's a lot of things that we could change this for men. And I do think with improving technology, we can make some of those changes.
What do you think is leading to that shift that you're seeing that men are engaging in healthcare sooner?
Um, social media is it's normalizing the conversation. Seeing a celebrity talk about his infertility issues or his low
Mm.
testosterone issues, hearing that can normalize the conversation for a lot of guys. It gets them more willing to talk. Um, that and uh, yeah, I think young men are engaging these conversations more than they did before. It was taboo to talk about having erectile dysfunction. It was one of those things back. I don't know, for a 60-year-old guy, I was like, hey, put your bootstraps on. It's part of life. That's what it is. Suck it up. But now men are willing to talk about it, and we have treatments for this. So it's not one of those things where it's like, suck it up. We have we have
Mm.
good treatment options for men at all ages for this.
It's so interesting because we talk a lot about women's health, obviously, in the podcast, probably more than men's health, but there is this like disenfranchising conversation for women that, perimenopause and menopause is a great example where there's been decades of time where people have said that's just aging. You have to just get used to that. And what I'm hearing you say is the same thing happening for men, and that it's starting to transform. And I see that myself. Like, I was talking with someone about the age that my grandparents passed away, which was in their 60s of cardiovascular events. And now my parents are in their 70s, and the way they're aging is so different than their parents were, where in your 60s, they were practically ancient and, not as involved in their health, where my parents are like golfing many days a week and out with friends all the time, and they're in their 70s. It's like the aging has transformed. I think stopping smoking has probably been a huge impact
Yep.
on that, because my grandparents smoked. My dad used to smoke but stopped when he was probably 30. And so I think that's changed the trajectory. But the expectation of health into later years has really changed. And men expect to live well, women too. We expect to live well and live healthfully and have good quality of life later into our later years. And I think that's transformed the way we engage with healthcare earlier on as well.
Yeah, but I think there's gonna be different vices. This, there'll be, people are drinking less too, which is good. But I do think,
Hmm.
but now vaping is becoming more popular.
Right.
There's gonna be different vices that there's always like like kind of a cat and mouse thing here. But I agree with you. I think ultimately, I think there's a much bigger desire for younger generations to live longer with biohacking and all these trends, which hopefully it's not just one of these trends. It does have some long-term viability to it.
Yeah. Great learnings that can come from that information. Awesome. Well, it's been really wonderful having you on the podcast, Dr. Houman. Thank you so much for spending the time with me today. If people want to learn more about you and your practice, what are the best places that they can connect with you?
Yeah, they could look me up. My name is Justin Houman, Houman, on the various social media channels on my website. But yeah, if you look up my name, Justin Houman, you'll find different ways in which you could contact me.
Great. Well, we'll make sure we link to all of your social on the podcast show notes. So if you guys are listening, wherever you are, you can click on that episode and scroll down and get connected straight away. So thanks, Dr. Houman, for joining me.
This was great. Thank you so much.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, Be sure to like, follow, and subscribe wherever you get your podcasts.